Good morning, everyone. My name is Mariam Zaidi, and it is my absolute pleasure to welcome you all to a European Cancer League Prevention and Early Detection Working Group debate taking place on World No Tobacco Day. How will Europe achieve its first tobacco-free generation? That is the big question that we're going to try and answer today. Tobacco consumption is the single largest avoidable health risk. According to the World Health Organization, tobacco kills more than 8 million people a year. Now, all the way back in 1987, the WHO created World No Tobacco Day to beat the drum on tobacco epidemic and the preventable deaths and diseases that it causes. The day is also a lever to encourage governments to shield young people from predatory tobacco marketing tactics that encourage their lifelong addiction. And in today's world, tobacco companies have a great new gadget of creation to do just that. Walk down a street and it's not long before the waft of a candy or fruit-flavored e-cigarette will hit you. Not only have adults in their droves turned to electronic devices to curb their addiction to traditional tobacco products, but e-cigarettes are the cool product du jour amongst under 18s. It's estimated that 37 million young people between the ages of 13 to 15 years old are now using tobacco. Between January and April 2023, in Italy alone, so just one member state, 16 million devices and almost 32 million millilitres of e-liquid was sold in 4 months. That's absolutely staggering. So here's another question. Are e-cigarettes the lesser evil or a Trojan horse of addiction? Well, this morning, ECL launched their latest paper on regulating novel and emerging nicotine products. There should be a link in the audience chat page for all of you to read it, and you'll hear a lot more about this paper later on from one of our keynote speakers. The paper forms, of course, the backbone of our conversation today as we zero in the products used to keep people of all ages addicted to tobacco, not just vapes, but also things such as heated tobacco products and pouches. So what will our panelists say are the levers to claw back growing concerns over new tobacco products? Is it price? Is it perhaps graphic warnings? What about age restrictions? Or could the most definitive way be to ban future generations from ever buying tobacco in the first place? Well, just as New Zealand scrapped plans for a ban, the UK Parliament voted to introduce a smoking ban for anyone born after 2009. Although, unfortunately, that's unlikely to become law before July's general election in the UK, so that might never happen. So we've definitely got lots to discuss, everyone. But before we get into the thick of our debate, let me go through today's flow. I'll hand over to two keynote speakers. The first will set the scene on tobacco control, and the second will highlight the main points of the ECL paper on regulating novel and emerging nicotine products. We'll then move to our panel discussion. That will then be followed by a 15-minute audience Q&A. Guys, this is where we really want you to get involved. So submit your questions and address them to the relevant speaker. Our Q&A is up and running and it's already waiting for your comments. I know that this is a big topic. We all know all of these devices, or at least we know one of the main ones. So do get involved, ask your questions. Right, but before we start, again, a few housekeeping do's and don'ts. This webinar, if you haven't seen, is being recorded. The recording will be made available on ECL's YouTube website and channel, so you can, of course, find it there once this has stopped being live. Audience, as I was saying, keep your camera off and your microphones muted. No one needs to see or hear you eating your cornflakes or whatever breakfast you're eating right now. And submit your questions. It's really important that you do. Please submit your questions. We really want this to be an interactive debate. Use a Q&A function, please. And those questions should, as many of them as possible, will be answered during the Q&A function. So please do also use the chat function if you want to make comments or you want to liaise with the participants or organisers. Okay, well, we've got all of that out the way. Let me now hand over to our first keynote speaker of the day, To set the scene on tobacco control and market developments in Europe, please welcome Lilia Olefir. She's the Director of Smoke-Free Partnership. Lilia, please go ahead.
Thank you. Good morning, everyone. Next slide, please. So today I'm speaking on behalf of the Smoke-Free Partnership Coalition. We are a coalition of over 55 NGOs that work across Europe. Next slide, please. Let me bring us back to the big goal and the big mission that EU as a collective decided to accomplish in a very near future. So I would like to remind everyone that Europe's Beating Cancer Plan, among one of its goals, has a very clear objective to create a tobacco-free generation where less than 5% of population uses tobacco by 2040, compared to around 25% in 2021. And the interim goal is to reach the WHO target of 30% relative reduction in tobacco use by 2025, which is next year, as compared to 2010, corresponding to a smoking prevalence of around 20%. So I think everyone is waiting for the new Eurobarometer that has to be released this year to see whether we are meeting the interim objective of 2025. Next slide, please. The intention of the Europe's Beating Cancer Plan was to support the revision of several legislative files, because we know that for tobacco control, the population-based policy measures are the most cost-effective measures to prevent the uptake of tobacco use among teenagers and children, and to encourage smokers to quit. So let's take a look on how well this commission have done in implementing the roadmap and the initial very specific plan and goals to achieve a tobacco-free Europe through revision of the Tobacco Products Directive. So as we can see, the Commission was planning to adopt the proposal in 2024. That hasn't happened yet. So where are we at that plan? Because the Commission intended to publish the evaluation in 2022 and impact assessment and the proposal in 2024. However, not even the evaluation is published. Next slide, please. Here you can also see the other files, the directives that the Commission intended to revise. Very important one on the revision of the Tobacco Tax Directive. As you can see on the right column, Commission intended to adopt a proposal in 2022. The proposal hasn't even been published as of May 2024. And same goes for the updated Council recommendation on smoke-free environments. It was planned for 2023. However, the proposal was not published, and the reason that the Commission used to justify that is that the work is ongoing and evidence are being gathered and analyzed. Next slide, please. So now let's see what's happening at the market. Because the lack of the political will that we can see in terms of revising the directives, as I will present to you now, you will see that it's completely unjustified. So if we look at the EU market share by the product, we do see that conventional tobacco products still dominate the tobacco market. The data that you can see in front of you is the Euromonitor data from 2022, and this slide is a courtesy of Dr. Michał Stoklosa, who is the economist working for the World Health Organization. So still 92% of the market is dominated by cigarettes, roll your own tobacco. And although the share of the so-called new and emerging products is relatively small, we see that for heated tobacco products, it's 5%. For electronic cigarettes, it's around 2%. And nicotine pouches is around 0.35%. Next slide, please. But we have to acknowledge, and the data supports that, not just the data on prevalence of use of new products among the young people, but also data on sales shows us that sales of new products are growing rapidly and require regulators to have a closer look at the market as soon as possible. So this graph speaks for itself. We see how rapidly the sales of nicotine pouches, heated tobacco products, and vapes are increasing. Next slide, please. Why the sales of those products are increasing? There are profits, big profits behind those new products, behind the market. Global e-cigarette market estimated to be worth more than $22 billion dollars. Here we're talking about the global market, not just the EU data or Europe, but we know that Europe overall is not that different if we compare it to the global market. Although the market is largely fragmented with smaller non-tobacco companies dominating, but transnational tobacco companies account for around 1/4, and we know of very well-known cases when tobacco companies acquired some of so-called former independent electronic cigarettes companies. Next slide, please. Estimates for the global market of heated tobacco product vary between 10 and 20 US dollars. Market here mostly dominated and heavily actually dominated by transnational tobacco companies. And variations might be due to the inclusion or exclusion of the separate parts of heated tobacco products versus sticks. Next slide, please. And global nicotine pouches market estimated to be worth around $2 billion US dollars. This market is quite similar to heated tobacco products market because again, it's dominated by transnational tobacco companies. Especially we are seeing that those transnational tobacco companies have more and more interest in developing and nicotine pouches themselves or acquiring companies that developed nicotine pouches. Next slide, please. It is in a way a vicious circle because there are other products on the market that are not yet gaining a rapid increase in popularity, but they might. So one of those products is Nicotino, a type of snus. This product delivers the same amount of nicotine as traditional snus, but dissolves within 2 minutes, making its use faster. And then on your right, you can see a very, very new product that is called Sniffy, a powder that can be legally sold in tobacco shops. Currently, it's only available in France. Although it's officially not a tobacco product, it's intended to be snorted and provides an instant energy boost. And the fact that it's sold in tobacco shop indeed raises many questions. Next slide, please. To sum up, as we see lack of the political will from the Commission to release the proposals on the revision of the Tobacco Tax Directive, Tobacco Products Directive, and Council recommendations on smoke-free environments, we see a rapid increase in consumption of new products. And we know that if we look at the marketing of those products, the target audience are teenagers and young people. Therefore, I would like to encourage the member states and national governments not to wait for Commission to act, but change their national legislation and do what they can to encourage the revision of the EU level legislation, because we don't want to leave anyone behind. And we see that many countries are taking actions. And I think we will be speaking more later today about Belgium, who've succeeded in banning disposable vapes, and the legislation will be enforced very soon. And same for nicotine pouches. Next slide, please. Thank you for your attention.
Well, thank you for adding to our conversation, Lilia. I think that was a great presentation. It really did set the scene. And I have to say myself, I'd not heard of Sniffy. Yeah, so we're definitely going to get into that, and we will perhaps come back to you a little bit later in the audience Q&A. I know that I have some questions for you myself, but let's keep things moving and let's go to our next speaker then, to the chair of ECL's Prevention and Early Detection Group, to discuss this new paper then on regulating novel and emerging nicotine products. It's over to Cristiana Fonseca. Cristiana, over to you.
Thank you very much. And I'm thinking that we are beginning the webinar, and I'm already excited with so many things that we have been hearing and understanding that it's a lot much to discuss further in this morning. So I would like to welcome all the people that are attending the webinar. I'm realizing that we are over than 100 people. So this is a proof that these issues regarding tobacco are not still well done, and all of us understands the importance of keep doing the work and keep analyzing this problem in order to tackle it. So I will kindly ask Nico to show me the next slide. And first of all, I would like to present, if anyone doesn't know yet, ECL, because in fact, we are existing for more than 40 years now. We were founded in 1980, and right now, we have 32 members in 27 countries in WHO European region, but from these, 22 are in fact European Union member states. And who are these members? We are non-profits operating across the whole cancer continuum and patient pathway. And giving the Portuguese example, for instance, I am a health educator, so we work on prevention and primary prevention. We do screening, and then we support patients. So this is the same thing that happens all over these 32 members of ECL right now. Cancer leagues are, in fact, the main resource for the public for cancer control information and services. And that's why it's so important for us to have an ECL with us, gathering and enabling discussions that are enriching our action every day. Next slide, please. We do a lot of work, and in these 24 years of work, every year we are going a step further. And the fact that we have so many projects handling at this moment, I'm not able in these short minutes that I have with you to explain all of this, but I want to enhance the project Bumper that we are realizing at just this moment. That is a European Commission funded project regarding a NAP that will going to enable people all over Europe to know about European Code Against Cancer. And we have, of course, EWAC. We are on the last day of European Week Against Cancer. And every year, ECL struggles to do something regarding EWAC. And in fact, this year, again, it was a key International Awareness Week on the health calendar. We have several people engaged during the whole week. And going through the social media from ECL, it's easy to understand so many things that were happening at the same time. And of course, taking this opportunity to go further with the European Code Against Cancer and to leverage the ECL manifesto for the 2024 European Union elections. Next slide, please. And today, my important role here is to present this paper that we have just launched, the Regulating Novel and Emerging Nicotine and Tobacco Products paper. I want first to address and to thank the team that have worked on this paper for more than one year now, both on ECL Secretariat, but also on the tobacco subgroup on prevention and early detection ECL. We have been together, all the leagues, in order to launch this paper that we understand it's very important. And why? Because we want to produce ECL recommendations to advance tobacco and nicotine control in Europe. We find it important that even the fact that tobacco is a well-known issue, we understand there are always novelties and we should be updated, and we should also discuss between ourselves in order to have a better approach. And so that's why we have this output to present you today, a reflection paper on novel and emerging nicotine and tobacco products. And yes, this NENTPs is something that we want to be well known on the next years to come. That's a new definition that we understood it was important to do before all. And this paper intends to give you recommendations to advance tobacco control in Europe, covering the domains of policy, research, and communication. And who is this addressed? Okay, they have cancer, public health, and tobacco control advocates and health professionals. That is a document that we intend professionals to use in order to better communicate, to better advocate, to better research tobacco control European-wide. Next slide, please. And I was saying to you that NENTPD, it will be a definition that I want you all to use for the next years. And so that is novel and emerging nicotine and tobacco products. I can say to you, it was not an easy task to get to this, because we are aware that, for instance, talking about novel, in some years, they will not be novel, they will be old, but right now they are novel. We could say about non-smoking tobacco, but the truth is that we want to tackle the issue. And the important thing is for people not to use this kind of tobacco products. So for us, right now, novel and emerging nicotine and tobacco products is the best definition that we were able to find. And these NENTPs refer to products that entered the market after 19 May 2014, the day in which the Tobacco Products Directive was formally adopted. Such an example could be electronic cigarettes, heated tobacco products, or nicotine pouches. Next slide, please. And I believe that you already know about these definitions of these several products, although I'm not going to read it for you all because this will be recorded. You can have access later on, but I want to enhance the health risks that we are talking about. So these products serve as potential gateway to cigarette smoking that we call the gateway effect. And they also have adversely affects brain development, dangers during pregnancy and fetal development, and has been linked to the promotion of tumor growth. That is not an easy task to make people understand that in spite of the fact these products most of the times don't have even smoke, they are still dangerous. And we have to address this. Even if these products are also mentioned as potentially good to help people stop smoking, they still have dangers. So this is something that we have to know how to communicate in order to better, to enable people all over Europe and all over the world, in fact, to understand that they shouldn't start smoking these kind of products. Next slide, please. And let's get to the recommendations. And regarding one of the three main pillars, so policy, we would like to recommend you all to strengthen enforcement of strict regulations on the European level for novel and emerging nicotine and tobacco products, ensuring alignment with existing tobacco product standards and adherence to FCTC's Articles 5.2. Also, we would like to prevent high nicotine content products from entering the EU market. And of course, encourage the integration of a One Health perspective into tobacco and nicotine regulations. Is mandatory to development of long-term and stringent medicine product regulatory pathways for any NTPs to follow in order to safeguard public health. And we should prioritize the commitment to the FCTC Article 5.3 principle of non-interference across all EU regulatory processes concerning tobacco and nicotine products. Finally, in a policy matter, we'd like to continue prioritizing traditional smoking cessation methods as precautionary measure until independent research results become available. Next slide, please. Regarding research, two very important recommendations. Strategically invest in robust, evidence-based communication surrounding NENTPs to ensure accurate and reliable information reaches the public, fostering a well-informed health literacy society. And not less important, direct EU funding towards independent and systematic research on the impact of NENTPs in member states in which NENTPs are being recommended for smoking cessation. And finally, regarding communication, because we all communicate and we need policy to advocate, we need research to know what we are talking about, but in fact, communication is a key target for all of us. So we need to strategically invest in robust, evidence-based communication strategies concerning NEATPs. We need all stakeholders acting in the interest of the public, from EU institutions to public health professionals in tobacco control policy, advocacy and research, must use accurate, neutral and encompassing terms for tobacco and nicotine products. We should also aim to agreements that should be found on product definitions within the policy and legal framework. And finally, we want to relaunch the EU Commission Ex-Smokers Are Unstoppable campaign to motivate citizens to quit smoking and educate them about the risks of consuming tobacco and nicotine. Next slide, please. I would also thank you all. And in this thank you, I'm thanking you that are attending the webinar today, but especially the team that I am representing here, Daniela Gianreco, as the responsible of this subgroup on tobacco prevention. Also the ECL Secretariat that has supported us on the redaction and launching of this document. And above all, the members of ECL that still believe that it is an important issue to tackle. And every time they are asked and invited, are with us together in order to analyze and disseminate this important document. And right now, I will also thank you all in advance, because I'm sure that the more than 100 people that are seeing this webinar will for sure, on the end of it, will be our best allies in disseminating this very important document. Thank you very much.
Thank you so much, Cristiana. And thank you also for highlighting the main points of the new ECL paper and some of those recommendations. I think, for the audience especially, just to have that one little nugget of information that the last definition of these new novel products and emerging products was in 2014, of course, when that legislation came in. I mean, 10 years is a long time to go without updating legislation. So let's hope that we can, make this conversation go forward and perhaps find some solutions to get things moving in the right direction. Okay, and I'm sure, again, audience, if you've got questions for two of our keynote speakers, do put them into the chat page. I know I have some for them already myself, but I'll let you guys handle that section. The Q&A is for you. Okay, but this part is for me to do now. So over to then our panel discussion. Joining me are Dr. Angela Ciobanu. She's the Technical Officer of Tobacco Control at WHO Europe. We also have Dr. Jérôme Foucaud. He's the Head of Department Research for Humanities and Social Sciences, Epidemiology and Public Health at the French National Cancer Institute. We also have Dr. Eline Remue. She's a Policy Officer at the Belgian FPS Health, Food Chain Safety Environment. And last but not least, in any way, we have Carlos Torrado. He's the Youth Ambassador for the Association of European Cancer Leagues. So thank you all to all my panelists in advance. I know that we're going to have a great conversation. But before I start badgering you with all of my questions, let me give you all the floor to introduce yourself. So we'll go in order of introduction. And Dr. Angela, please take the floor first.
Yeah, good morning, everyone. My name is Angela Ciobanu. I'm Technical Officer on Tobacco Control in the WHO region for Europe. Thank you.
Well, I think that it's my turn. I'm Jérôme Foucaud, the Department for Research in Social and Immune Sciences at the French National Cancer Institute. The French National Cancer Institute is very involved in this question, and I'm very happy to be here today to discuss this very important topic.
Dr. Eline.
Good morning, everyone. I'm Eline Remue. I'm working at the Ministry of Health in Belgium as a policy officer on tobacco and e-cigarette policy, and I'm excited to be here in this panel, and I hope we have fruitful discussions.
Good morning, everyone. My name is Carlos Torrado. I'm a youth ambassador for the European Code Against Cancer, which is a European Commission initiative to disseminate 12 ways in which one can prevent cancer, and I'm very excited to be here in this panel discussion.
Okay, thank you so much. That was very short and sweet. I was expecting a little bit longer. Okay, first of all, panelists, I'm going to throw a question out to all of you, and perhaps Dr. Angela, since you're the first panelist on the list, I'll come to you first for this. What would be your thoughts so far on what you've heard from two of our keynote speakers, and especially on that ECL paper on novel and emerging tobacco products? Any sort of initial thoughts?
Yeah, first of all, they're all together. There was grouped in all one products. At the same time, you have to mention that there's nicotine products and also tobacco products, because heated tobacco products is a tobacco product, and we have to make a difference between them. And yeah, it's the definition that we put and we also use, but we got away from the term of novel. Now we are using new, but given the term of the new and emerging nicotine tobacco products. And we also have to take into consideration that to have the specific definitions for different categories of these products is also important. In terms of the recommendations, I think that it's quite straight away, because first of all, we have to regulate very strongly this product. Due to the fact that in many countries, these products are picked up by the children, and we have kids of 9-10 years old that are using this product, and this is unacceptable, I think, and countries have to take measures to regulate these products. Unfortunately, not many countries regulate strongly these products, in our region, we have only 3 countries who totally ban the products, not only disposable, that some countries, but totally ban. This is Turkey, Turkmenistan, and recently is Kazakhstan, who banned the products, and the ban will enter into force on the 1st of June this year. In terms of the regulation of these products, we have to take into consideration the characteristics, because each of these have different characteristics, and we have to regulate strictly. For example, in the electronic cigarettes, they can be the design of the products have to be also regulated and should be included, and other measures have to be put. And I'll discuss later, because we published it in December 2023, the call for action and the technical notes providing countries with different regulatory approaches how to regulate these products.
Let me just quickly pick up on one thing that you said before I move on to the other panelists. You brought up design of the e-cigarette. And I think that's a really key point, because they look so cool now. They're these tiny little things you can stick inside your pocket or your tiny handbag or whatever it is. They're so easy to carry around. A lot of them now, as we know, I mean, like we said in Belgium, the disposable ones are being banned now. But they look so appealing, and that's something that we really need to zero in on, isn't it, Dr. Angela?
Oh yeah, absolutely. And I would like to mention that in some of the countries, we have on the market electronic cigarettes that look like a toys, like lipstick, and there are that's put in the hoodies and so on. They make like a usual tools that we use, and it's practically very difficult to distinguish between them, and this have to be stopped, because even parents cannot distinguish this is the lipstick that you're using the girl, or this is the electronic cigarettes, or the pen, or others, and this have to be regulated. And also I want to mention that currently there's many electronic cigarettes that can be manipulated, can be increased the power, and increasing the power, it's meaning that it's heating of these products. The liquid is heated at a high temperature, and the kids are inhaling much larger quantity of the aerosol with all these toxic elements and so on.
Indeed, there's so much inside them that we don't know. So Dr. Jérôme, then coming to you then, set the scene for us on what we're sort of facing here. You know, the speakers so far, they've set the scene, but when it comes to these new novel products, in your mind, are they a tool to help people quit smoking? Or do you think that because perhaps of the lack of legislation or the regulation of them, regulation being the more important word here, has this created a kind of monster of addiction?
Well, maybe first of all, I have to underline that I'd say Angela before we have clearly to pay attention when we are talking about a new tobacco product. Heated tobacco, it's tobacco product definitely, and we don't have to confuse that. And secondly, when we are talking about a new nicotine product, it's another point. Definitely here, I represent the French National Cancer Institute, and we know that we don't have at the moment, we know that nicotine, it's not a carcinogen product. We know that nicotine is the well-known pesticide, nicotine is the well-known agent of addiction and is strongly documented, but definitely nicotine is not carcinogen product. And for proof, we can use nicotine products to help people to quit smoking. The major question that you ask you here, it is when we have this new product of nicotine, not tobacco, is it product to quit the addiction, or is it a new gate to start the addiction? And here, definitely, we have a lack of evidence, we have a lack of research on the trajectories of the users. Definitely, if you compare the situation between France and United States, we can see that the situation is really different. We can maybe think, but we have a lack of proof and we have a lack of evidence at the moment, that maybe in the American side, it's maybe a gate to start the addiction. In European side, we don't have that. Definitely, as you said before, this new nicotine product, like puff, for example, are very fancy product, are very trendy, are very attractive, are very colorful, with a lot of flavor. And we can ask if we need really this type of flavors, this different flavor to quit smoking. And here I think that's the example of Netherlands. Netherlands have decided to allow only few flavor for the e-cigarette and especially for the juul. Maybe it can be a good perspective in this way. But to answer clearly to your question, at the moment, I can unfortunately answer to the question, we don't know.
Okay, with a no, so I guess that's a good thing then. But just quickly before we move on to the other panelists, then your thoughts on nicotino and sniffy. How dangerous are those to people that might want that are perhaps consuming them in some sort of way?
The question is for me?
Yes, it was for you. Yeah.
When you are talking about the sniffy, you are talking about the new product that we talked about before. Yeah, well, definitely it's a very new product. It's allowed in France in the moment. I'm not a specialist of this product, but I have a look at that. It's something that I know do not contain any nicotine. It's not really a new nicotine product. It's more an energetic product. Definitely here we have something very, in my mind, that we have to pay attention. Definitely the code that they use this product, it's definitely close to the cocaine using, definitely. And here we have some things that they normalize this kind of behavior. And it is the same when we talk about, for example, e-cigarette, we are here in the perspective of the normalization of the behavior to smoke, to vape, because it's something like, yeah, okay, you cannot smoke, but you can vape. Well, the question here that we have is it that we would like to have a society without nicotine or without tobacco? And we have to consider that. Definitely the debate is very important between Europe side and American side.
Sorry, my computer's not working so great there. Dr. Jérôme, then, just before I move on to the other panelists, then. So you made the distinction between a nicotine-free and a tobacco-free society. Which one is the lesser of the evil? Can we do both?
I think that it definitely is a position of the poster of different country. For example, if you pay attention of different publications from United Kingdom, we are more in the way to have free tobacco society, but not really in the perspective of the free nicotine. But the question here, do we need nicotine or not? I don't want to ask to answer to the question here because we have a lack of data. Definitely, if we use nicotine, do we move in the perspective of tobacco use? We don't know really that, and we need to study that more. And we need more research in this perspective, and especially two types of research. What is the impact of health? Definitely, and especially with e-cigarette and the other one, we have a lack of data at the moment. And the second point is, what is all the trajectories of the users? When you start by e-cigarette, do you move in the using of tobacco? It's important question, important topic at the moment.
It is a very important question, and we'll come to the gateway effect. So Carlos, be on standby. But first of all, I want to go to Dr. Angela, who wants to say something.
Yeah, I just want to comment about the role of these products in cessation. First of all, we have to take into consideration that these products are put on the market as a consumption product, not as a cessation. They are advertised by the industry like as safer products, but are put and advertised to all population, and we have to be very careful. Any products that are meant for the cessation, they have to be proven their safety and efficiency. But these products, as they are put and distributed now, they didn't prove this at the population level. Thank you.
Thank you very much. I think that's an important question. And audience, do we have anyone here that perhaps has tried using e-cigarettes to cease smoking, or as Dr. Angela says, is it more of a consumption product for you? Did it get you, as our other panelists were saying, normalizing the effect of, smoking, etc.? So please do get involved in our chat page. Okay then, Carlos, I'm going to come to you then, because I know that you have many thoughts on this gateway effect idea. So does taking up some of these products, do you think it then opens up this gateway to a larger addiction perhaps? And if we also bring in a few points that were raised earlier, the design of these products, we're living in a more consumer society. And when I think about the design specifically of these e-cigarettes, the way in which they perhaps started off very bulky, very clunky, and now they're quite small and streamlined. And as they were saying, they can, as Dr. Angela was saying, they look like a lipstick, or they can fit into your pocket. It seems as if in a way that, the people who are making these devices, they've realized that we live in a very consumer generation, and young people especially, who of course we know are targeted by tobacco companies, they want the newest looking gadgets. And so they're tapping into that. They're creating things that look nice, that look small, that you can take anywhere. But yeah, so a comment perhaps on that, but also the idea of the gateway effect, please, Carlos.
Yes, thank you, Mariam. Yes, first I want to start with the gateway effect, because here we need to distinguish between the effect that these products have on public health, and also the effects that they have on children's health and the development of their brains. It is clear that until 1964, the effects of cigarettes was not completely understood. We didn't know how many diseases it caused. We're still learning more and more nowadays. So we cannot expect to know what the long-term impact of electronic cigarettes will be just yet. However, what we know is that there is a gateway effect. We know that there is dual use, which perpetuates users into nicotine addiction, because they are going to be smoking cigarettes outdoors. Indoors, they will continue to use electronic cigarettes, and this will just increase their long-term use of the product. With regards to gateway, now there is a lot of available evidence in which we can see through secondary sources, but also primary sources. If you take statistics, surveys, you can by yourself look that users that started, citizens that started using electronic cigarettes now are also smoking. There are multiple cases, and the data already shows it. So what is going on? The industry has clearly a strategy because the revenues that they are getting from cigarettes have been decreasing in the last decades because of all the tobacco control legislation that has been progressed since the FCTC, but also before. And now their strategy focus on getting the next generation addicted to these products. So they make them colorful. They make it with very attractive packagings. You have them in multiple flavors. They have candy flavor, cloud flavor, fruit flavor. There are hundreds of flavors available, and they sell them next to candy. So kids, when they leave they finish class, they go and buy these products. However, electronic cigarettes is not the only concern. From my colleagues in the youth ambassadors, I know that in different European states, they have a bigger challenge with heated tobacco products. In others, they have with electronic cigarettes. So it's not the only concern. Also, recently in Romania, they started selling a new heated product that is not a heated tobacco product, but a heated herbal product that is infused with nicotine, and it can be used on the same device that is used to heat tobacco products, and there is a lot of inaction. So this needs to be targeted also because it will be very costly for our welfare states. The economic costs of tobacco are huge. They are estimated to be between 2 and 3% of the annual gross domestic products of our European economies, and with the amount of elderly people increasing, well, it's scary what will happen.
But let me ask you this then. I think I mentioned it during my introduction. Do you think that the e-cigarette is the lesser evil when it comes to the traditional cigarette, or I don't know, people that smoke pipes, etc., those very old-fashioned traditional products? Or do you think this is a Trojan horse of addiction? Because as you were saying, you go into any sort of shop, and sitting at the counter, you have all the different flavors for all of these e-cigarettes next to, as you said, the candy. I mean, it's so easy to buy.
Exactly. This is the issue, because if the industry really wanted to expand their corporate social responsibility, as they usually sell these products, then they will not make the packaging so attractive. They will not put thousands of flavors when data evidence shows that those smokers that are 40, 50 years old that want to quit smoking to prevent, early mortality, they use tobacco flavoring in their electronic cigarettes. They don't use cloud flavor or candy flavor. So clearly, these products are made to addict the next generation of smokers, and this is the issue here.
Can I also ask, is the appeal perhaps to younger generations the fact that they can, I mean, obviously, I think there are stipulations or bans perhaps for using e-cigarettes indoors, but it's not absolute. It's not like a cigarette. So is perhaps part of the appeal the fact that it's not that traditional, or it's smokeless in some sort of way, so that they can just carry it and use it as at will if they want to?
Well, the aerosols that come from the electronic cigarettes, and also if we talk about tobacco products, now there is evidence that some kind of combustion occurs because there is carbon monoxide in the aerosols of heated tobacco products. But the problem is the legislative framework. In many European member states, the legislation is not clear on whether you can use these products indoors or not. A lot of times depends on the owner of the hospitality venue. And this is an issue because there's a lot of inaction. And it does make it more attractive, because if you are able to smoke it indoors and people see that others are smoking these products indoors, they question, why is it allowed? Why do governments not act on it? Is it because they are not damaging to health? Is it because there is no secondhand aerosols? And indeed, secondhand aerosols are a big issue because they do have an effect, particularly on children and pregnant women. There are metals present in these aerosols, and they need to be targeted. And inaction is a big issue here nowadays.
And then just one last question before I move on to the panelists. Then you brought it up yourself, but do you feel as if the powers that be, governments, are letting down the youngest generation by not regulating or not trying to make a difference to combat the use of these products?
Exactly, and bring back the welfare state, because now we know that the populations in Europe are facing challenges. So we are little youth for a lot of older people, and if we do not resolve, if we don't target determinants of health, health is a big toll for our economies. So if we want to keep our, let's even say, our pensions for the future, we also need to address public health, because obviously politicians nowadays, these policies, they don't have an immediate effect on us. So the effects are not seen until many years pass. So there is no political gain that will be immediate. However, it does have a long-term effect, and in the future, we will all regret not acting now.
Indeed, and we will come to Dr. Eline, because I know that obviously we want to talk about the Belgian perspective, because when we are talking about countries that have done something, we know that Belgium has. But first, I will go back to Dr. Angela, because you wanted to speak briefly about the adverse effects of e-cigarettes and their dual use. Please go ahead.
Yeah, first of all, Carlos already mentioned that along with nicotine that adversely affect the development of the fetus and the pregnant woman and can affect the development of child brain, and there's a lot of materials about this. The electronic cigarettes also emit toxic chemicals that some of them are known that cause cancer. Of course, we don't have data because we have to wait until the effect will be, but I would not surprise that we'll have in the coming years more data on this. And alarming evidence is of the cigarettes' adverse effects. Population is maintaining. We have every day we have additional papers that publish it in terms of the adverse effects. The use of the electronic cigarettes is associated with increased risk of cardiovascular disease, metabolic dysfunction, lung disorders, and other adverse effects. And the latest publication, systematic review that was published recently in 2024, established that there is no difference in the risk associated with electronic cigarettes use versus conventional cigarettes for cardiovascular disease, stroke, and metabolic dysfunctions. There is slightly lower risk on asthma, COPD, and oral disease. However, I want to mention that in a study of among the 15-16-year-old students across 33 countries in Europe showed that 6.4 overall current dual users are, where in the Nordic countries and some jurisdictions, the prevalence of the current dual use range from 23 to 31%. And in terms of the health effect, the dual use have much higher health risks and included for respiratory and oral diseases. And we also observe that trends of the increasing in dual poly use are increasing. Thank you.
Thank you so much for providing that context. Okay, well, we've been talking about the adverse effects, but there is one member state, as ECL have highlighted in their paper, that is doing a lot of good things for controlling these kind of new products. So we'll go to Dr. Eline then. You know, the previous panelists were saying that, you know, governments are, well, to paraphrase, I would say, to paraphrase Carlos, that governments aren't necessarily doing enough to regulate all of these products. But we know that Belgium is actually doing a lot of good things. So Dr. Eline, talk to us about why Belgium is one of the member states that is actually doing, you could say, or leading by example. I know that you played a crucial role in making sure that snus, disposable electronic cigarettes, were banned in Belgium. And you're also working on a smoke-free generation, just like what the UK is trying to get through, but they perhaps won't do it because they are going to have a general election. So yes, so please, the floor is yours. Please
Yeah, thank you. I heard a lot of things that I thought, yeah, I can tell something about that. But the thing in Belgium, the difference between now and some years ago is that we have a Minister of Health that is ambitious, that understands the problem, and who's really wanting to take action. So under his governance, or how do you say it, we had interfederal strategy that was agreed on at the end of 2022. And it's a strategy towards a smoke-free generation in which we build in a lot of actions that already implemented now or are in the pipeline. And that's the thing, it's a very complex team. We have a lack of data, and to protect the young people, you need a lot of barriers, multi-layering of regulations to stimulate protection, because indeed we lack the data. And I think in the future we should turn it around, that if there is no data, you can't have access to the market. That would be better. But I come to the future, I come back to that, because now we have the fact that these products are regulated as consumer products. And that makes it really challenging to find the balance between access for those smokers who might be able to quit by using those products. I'm saying it conditionally. And at the same time, protecting young people, non-smokers, from using these addictive products. We know they're addictive and probably not good for your health. So the first barrier we have, it's obvious, it's the age limit. In Belgium, it's still at 18 years, but we see in practice and theory are two different things. So our inspection unit, they had a campaign last summer. They used mystery shoppers, so people of 15, 16 years old, to go into shops and buy products that they are not allowed to buy. And they saw infractions in 70% of the controls. The young people were able to buy tobacco, disposable e-cigarettes. That's why in our strategy, we are building in those mystery shopper campaigns for the future. So now it was a sensibilization. It was also announced, which makes it even worse. Those numbers, this high number of infractions. And so those who sell tobacco will as from, it's already entered into force, they will be obliged to ask for a proof of age if people look younger than 25. So to stimulate that the control is better. Other things, I heard that Carlos talked about that in some countries e-cigarettes are not under the smoke-free areas. In Belgium, it is, as from the beginning. And also in our plan, we also already had indoor smoking bans, but this plan of the minister also, as from January, we will have smoke-free outdoor areas, especially those areas where children come. And to come back to the question on banning the nicotine pouches and the disposables, I think these are necessary steps to protect the young people. For the ban on nicotine pouches, it came into force as from October last year, and we were lucky that actually it was not really popular yet in Belgium. And I think you need that. You need to act before it's popular, before it's a trend. For disposable e-cigarettes, the ban is not there yet. It will be enter into force as from January. To prepare this ban, it took a lot of time, because we were prevented by the European TPD to go beyond the TPD. So that's why it took a long time. And these products are already very popular. And I'm really glad the ban will be there, but it's too late, already too late. And that's a bit the thing. We're always lagging behind from, as a regulator, you you're running behind, and I hope in the future we will still have ambitious politicians also at the EU level, and that can turn around how we regulate. So we should act before it's a problem.
Well, let me pick up on that point you mentioned about lagging behind, because as you know, we're all sat here together discussing what should be done, what could be done. It sounds like a conversation that we were having, I don't know, about, let's just say 15, 20 years ago, you know, when the EU was looking to have this regulation 24, the directive in 2014, where we were saying, what can we do to limit the, the consumption of cigarettes? You know, nowadays, when we look at it, like you said, we've got bans in place, indoor bans, you've got some outdoor bans. You know, the packaging has become something, it's neutral now. It also comes with all these graphic pictures. You know, some countries have raised their age limits, but you know, all of that was good for traditional tobacco products, and now we're having this same conversation. So my question to you is it a good thing that we're finally having this proper conversation, that we're trying to regulate these products, or, as you were saying, has it just come too late, and has the problem got too big, perhaps?
I understood, but I'm only in this job for 4 years now, that at the time the product directive was discussed, there was the intention to have them regulated as medicinal products. But I think what we can see there is the influence of industry, and they made a choice to regulate it as a consumer product. And maybe at the time, the regulation, as you said, we had the 10th birthday of the directive, but it's not a happy birthday. The regulation, it's 10 years old, but we're living in already a society that's really fast evolving, and especially in tobacco and nicotine industry, they have a lot of money just to invest in novelties, and they know really good the gaps of the legislation. So you have the discussion on legislation, then the legislation enters into force, and already at that time you're lagging behind. They already know what are the gaps in the legislation. They already have product development to circumvent it. And I have the feeling as a regulator that we're using Scotch tape to close the holes. And then there's a new product, you make new regulation, and it's always fought into courts. So you're really lagging behind. So that's why I really would plead that at the EU level, we would be ambitious, and that I'm really, like Lilia said, I'm really eager to work on a new tobacco products directive, that it's more strict, and that has maybe not all, but several of the measures we are taking, we are preparing, that it would be EU-wide. One of those examples is it's already in place for a long time, online ban of sales, online sales ban for tobacco products, for nicotine products. But the Netherlands also introduced it last summer. But yeah, 2 countries, it's too small to be effective. So we need it globally. We start EU-wide, maybe. So with the 27 member states, I hope there are really good examples of measures that we can take, but I hope we can take all the 27 member states in the same boat of more strict regulations. I'm a dreamer.
Well said.
Maybe.
No, you can dream as much as you want. Well said as well. Dr. Jérôme, coming back to you then, and following up on what Dr. Eline said, is the problem too big for individual member states to really have an impact? Do they need the EU to come in as the white knight now? And can you see any signs that potentially the incoming European Commission will move on providing new tobacco legislation or regulation?
Here. Well, I think that it's complicated for me to answer from the European level. That we can say it is that the European level is very involved in this question. For example, the French National Cancer Institute is involved in a joint action named Joint Action Tobacco Control 2. And this joint action with the other member at the European level, we tried on two very important topics. It is the perception of the population of the e-cigarette, and also what is the perception of the population of heated tobacco. Why is important to study the perception? It's because that the perception is one of, not the main, one of the main determinant of the behavior. But definitely we can see in the studies as we conduct at the European level, it is that globally the population considers that e-cigarette and new tobacco product are harmful for us and especially are carcinogen. At the moment, as I said before, we don't have any evidence on the impact of e-cigarette on the cancer. Have I seen on the chat? Definitely, and also that Angela said before, a recent study was published in February. This study is named Population-Based Disease, all for e-cigarette and dual use versus cigarette. And in this study conducted by Glantz, Nguyen, and De Oliveira, if I remember well, they sum up a lot of data in scientific literature, and they show that we have something around the cardiovascular disease, also metabolic disease, and few maybe impact about asthma and the other lung disease. Well, if I can just answer clearly to your question, we can see that something is moving. In France, as you know, the French government have decided to ban or to work on the ban of the puff, the new one, and for the moment maybe to keep the e-cigarette. Also in France, we have decided maybe to target a new tobacco generation 3. It's 2032. Thank you. I have someone on my side. It's Jade, my colleagues, that did support me in this preparation, and that I would like to thank you again, her. Also, in France, we would like to maybe move in a perspective. We didn't talk about that before. We discussed a lot about what is the impact of the marketing, and definitely we can see that we have a very, very important impact of the marketing. Definitely, maybe the perspective is to ban the puff. I think that we are moving on that. Smoking ban in the specific public area, beaches, parks, forests, and I think that France is moving in this perspective. Limit the flavor also, in my mind, can be a very interesting point, maybe to reduce the impact of the spreading of this kind of product. And also when we are talking about the marketing, as you know, this kind of product is marketing. When you use a e-cigarette, is something like marketing. You are different, you are maybe special, and maybe also it can be interesting to have a plain tobacco packaging for all tobacco products, including heated tobacco, and maybe for the nicotine product, especially e-cigarette. And definitely that we know another point very important, it is the price of the tobacco. And when we are talking about the perspective at European level, maybe we can think about this perspective, how it's possible maybe to have similar price in the different countries in Europe. I don't want to be long to be able to discuss with the other panelists. I can maybe develop that, but I prefer to give you the microphone.
No worries at all. Thank you so much. But before I do allow bring all the other panelists in, you're from France, so you know it has an interesting history, you could say, when it comes to smoking. It's one of the member states where still to this day, I would say, when you walk around the city, you can see more people smoking than in other member states. Like, for example, if we contrast Belgium, you know, if you're working on a Parisian street, you're going to see a lot more people smoking than, say, for example, in Brussels. I think France has this unhappy image of being tied very much to smoking, or smoking being cool. So just for our audience as well, how much of that has changed since restrictions were brought in, and how much now are we seeing a sort of rejection of traditional smoking or tobacco products versus now these new novel products? How much are we seeing that in real life in France?
Sorry. Well, we are now in the top list of the people with a low rate of the smoker, unfortunately. I think, if I remember well, we are talking about something around 25% of the daily smoker in France, and we are around more than 32 current smokers. That I mean that I'm talking about people that not smoke every day, but they smoke regularly. Also, if we pay attention to another study, pilot by the French National Cancer Institute named the Barometer Cancer, and this survey is conducted in a representative sample of the French population, we can see at the same time that we have maybe the main important rate of the e-cigarette user. We are talking about 7.5%. Well, when you see that, you say to me, okay, Jérôme, but I think that it's not very good. But if you compare, for example, to 1993, for example, the rate of the daily smoker was 30% of the French population. We can see that we have a decreasing of that, and it's specifically due to my mind to the very volunteer policy of the French government to reduce that. But we can do more, definitely, and we have to do more to reduce the impact of to reduce the number of the smoker in France. And as I said before, maybe the new decade strategy for cancer, and also the specific strategy to reduce the tobacco will be a very important tool, policy tool to achieve this goal. Another point, very important, we didn't discuss about that before, it's a question of the health inequalities. The tobacco consumption, the tobacco behavior is definitely something that they consider the inequalities. It's possible to see, it's possible to understand that the main part of the smoker are people with low income and low level of education. And we can explain that, but I think that we don't have time to go deeper in that. But we have also to not improve the health inequalities, how it's possible to target all people to reach. It's something very important in this topic in my mind.
Thank you so much. I can see that the time is slowly running out for our debate. So let me just quickly bring in some of the other panelists then. Carlos, so a good point was made there about social inequality as well. So we can talk about that. But one of the things I also wanted to bring up was the tools that are used to try to limit the use of tobacco and nicotine products. And one thing that I read about in the ECL paper was about a Canadian ruling that would see health warnings printed on individual cigarettes. So these are cigarettes. So this is something else, obviously, to what our discussion is. But can you see, would it help when it comes to all of these new novel products? Say, for example, an e-cigarette, or even the pouches that people put up in their mouths. Would that help act as a very good deterrent if these individual pouches or e-cigarettes carried a health warning? So not just on the packaging, but actually on the device or the item itself. Would that perhaps deter younger people? And then also maybe a word on whether you think that younger people are turning to these products also because of social inequalities, or perhaps even anxiety, because we did recently go through a pandemic, and obviously anxiety, the lack of human interaction affected younger generations a lot more.
Yeah, thank you. So with regards to which policies can be taken and what will deter people from using these products, there are two, perhaps three policies that will help considerably. Number one is taxation. So in many of the European member states, these products are not taxed adequately. In multiple cases, for instance, with heated tobacco products, the industry takes the profit of this type of taxation. The income they generate from the tobacco products is considerably higher than for traditional cigarettes. For e-cigarettes, in a lot of countries, they are not taxed. They move freely, also because they are not covered under any monopoly that the state may have on the sale of tobacco products. But also something very important is packing and labeling. We mentioned many times the colorful packaging, the lack of health warnings, how the fruits are displayed on the packaging to make it very attractive. So of course, if you introduce plain packaging on all tobacco products, tobacco and related products, they should all have plain packaging in order to deter and for people to not get called by the colors. But if they want to use it, they will still buy them because you are not buying the product. And also health warnings, because you are informing the consumer of the harms of that product, and this is currently not transmitted enough. So these are the three main policies that you can take, and for children, they are all three very important.
Okay. Thank you very much. Okay, well, I'll start doing a bit of a hybrid of opening up the audience chat and maybe getting through a few questions that were pertinent to the debate as well. So, Lilia, I will come to you. I know that you wanted to respond to the question about what the EU can do or should do. So please go ahead.
Thank you. I think there is no question what the EU can do. The question is what the EU must do. And for yesterday, all the deadlines that were set now changed. And if we look at the new implementation roadmap that was published, according to that implementation roadmap, the Commission does not intend to publish any of the proposals. This is a huge scandal. It's absolutely unacceptable. We are all witnessing a huge increase in consumption of electronic cigarettes, heated tobacco products, nicotine pouches, and the EU just simply says that they are still gathering evidence. What sort of evidence are they gathering? We cannot wait. We just simply don't have time. And we know that many member states are ready and eager and want to work on it. So I want to strongly stress that the EU must do what the member states are asking the EU to do, and many member states are ready to move ahead. And let's be frank, countries that have the highest rates of tobacco use among the young people and adult population, those countries, they need the EU action the most, because for various reasons, mostly historical reasons, their governments are slightly reluctant, and they are coming to us and they are saying if the EU doesn't do anything, nothing will be happening. We still have countries in the EU that where tobacco use is higher than 30%, which is insane, because it's all human lives. We are talking about parents of children, and then their children seeing their parents using tobacco and being exposed to secondhand smoke or aerosol. So the members of the parliament, the new one that will be adopted, they have to make sure that the next health commissioner will take stance against the tobacco industry, because we know who is winning right now with all of the delays. The only stakeholder who is in favor of the delays is the tobacco industry. There are no doubts. So we cannot just simply allow the EU to follow through with the implementation roadmap that they've published. We have to use every single opportunity to call out the Commission, because right now it's not in hands of the Parliament. It's not in hands of the Council, it's in hands of the Commission. And we are specifically talking about DG Sante and DG Taxud. So the next commissioners, the Health Commissioner and Commissioner for Economy, it's completely in their power to release the proposals on the revision of the Tobacco Tax Directive, Tobacco Products Directive, and Council recommendation on smoke-free environments.
Oh, sorry, my microphone is taking a little while to unmute. Well said. Well, listen, look, I hope if the European Commission what is left of it for the remaining time are listening and watching. I'm sure they've got some food for thought there. I'm going to go to an audience member's question, Laurent. He says, what about the harm of addiction? Even if the nicotine delivery mechanism was psychologically harmless and the harm was only financial, wouldn't this concern you in the long run if these products flood the market and we end up in a situation where 80% of Europeans are addicted to nicotine? I think, Lilia, this is a question for you as well.
I think, apologies, I would need to read the question, but maybe someone is ready to respond first to that question, because...
Yeah, I mean, panelists, put your hands up if one of you wants to answer that one. Perhaps let's go with Dr. Eline. If we're talking about the harm of addiction, even if the nicotine delivery mechanism was psychologically harmless and the harm was only financial, wouldn't this concern you in the long run if these products flood the market and we end up in a situation where 80% of Europeans are addicted to nicotine?
Yeah, I believe we should. Well, I'm not in favor of addiction. It's if you have they call it freedom to choose addictive products, you lose your freedom by using them and getting addictive. And I don't know the science behind it. I once saw that nicotine use is very bad. It's really harmful, especially for young people whose brains are still adapting, changing, growing. But that the actual harm of nicotine when you're an adult, like over 30s maybe, it is, yeah, you only have the addictive potential, I think. So what we should do is, I think, focus on protecting the young people as, but I'm not a scientist on nicotine science, so there might be someone who
no worries. I think Dr. Angela has her hand up. Don't worry, I'll hand over to Dr. Angela.
Thanks.
Yeah, I'll try to respond to the questions, but first of all, yes, you're right that nicotine that is containing in all these products are highly addictive. And I also would like to raise, because we also mentioned about the new, novel and emerging products, and the industry try to placing on the market different products with different types of the nicotine, like a nicotine extracted from tobacco, synthetic nicotine. There is also nicotine salts that are making this product like a smoother with deep inhale, and is degrading the body much quicker, and much quicker you get addicted to this. There's also link with the harmful effects of this. And now we also observe that there's on the market nicotine analogs. Therefore, the regulators have to take in account all these types of the nicotine, and all this is about addiction. And there's a study that done in United States, in Great Britain, and Canada, in the 16-19 years old that use electronic cigarettes. And they mentioned that it's around from 40 to 50% of this youth are using these electronic cigarettes within 30 minutes when they of waking. It means they are already addictive to these products.
Okay, thank you very much. We have an interesting question. This will be, I'll give it to Carlos. This is for you. This is from Janine, and they say, how big do you think is the impact from social media influencers who promote new nicotine products like e-cigarettes to attract young people to nicotine products? I mean, that's a massive market. We haven't talked about social media and the influence it has and influencers. So how much are they impacting young people when it comes to tobacco products?
The impact is clearly huge. When new generations are all day on TikTok, on Instagram, they scroll and they keep they are bombarded by these products, particularly now nicotine pouches in European member states, because on electronic cigarettes sometimes the industry is more careful, but you still see electronic cigarettes, heat tobacco products devices. You see the devices that they go through a loophole in which they are allowed to be portrayed in multiple member states. But the impact is huge because they see all these colorful candies. You put nicotine pouches, you put them in the mouth, they have a very strong flavor. What they don't know is that in some cases they might have up to 40 milligrams of nicotine. This has an immediate effect because it travels from your mouth to the brain in seconds, and has an immediate reaction. So you feel good, but then you want more. And then when you want more nicotine pouches, you will want more electronic cigarettes, and then you will want also to try normal cigarettes. And this is clearly a concern, and there is a lot of inaction. We have seen that there has been a Digital Media Service Act, but if there is no legislation in the real world addressing it online, is even more complicated.
Thank you so much. Lilia, I'm going to come to you now, because this was something during your presentation, this was something that I thought, no, there's no way somebody's going to ask that question, really. And I did see it pop up in the chat. And, you know, I want to address it because really, you shouldn't even be asking this question. I'm sorry, anonymous, you know, participant. So in your introduction, you spoke about conventional tobacco products dominating with 92% of the share. And I thought instantly, oh my God, people are going to say, well, why should we care about these novel and emerging products? Why should they be regulated if it's only, what, 8% of the market? But my God, it's 8%. And if you're seeing the numbers of people that are using these things, but Lilia, you're the expert, so please tell people why they should care about the uptake in these novel products and emerging products, which are, you know, not dominating, but the usage is massive. But please, over to you.
Yes, thank you. I think it's a very good question because on the one hand, the message that we've, I think, explained well, those products are mostly used by young people. They are promoted and targeting the young people. But the second element that we don't quite give enough attention to is that when we talk about revision of all those directives at the EU level, the issue of the new product constantly brought as a reason for delaying. So the regulators, the decision makers at the EU level are saying that they are not quite sure how to regulate those products. They are not quite sure how harmful, how less harmful they are. Our perception is just an example of how the industry strategy is working. So back in 1940s, 50s, the industry created a perception that cigarettes are not causing cancer. They are harmless. You can even lose weight. Now we are sort of at the same stage, but with the new tobacco products. So the delays and the reasons behind the delays of 3 major files on taxation and products regulation that would still regulate cigarettes, roll your own, they have to regulate the new products. We just can't exclude them, but the fact that so-called harm reduction strategy that is widely promoted by the tobacco industry creates the confusion among the regulators. Some of them, to a certain degree, might be confused. That's why we are having sort of meetings like this one and others to explain the danger of the new products and how the uptake of this product might result in a new generation being hooked. And we understand why the tobacco industry is in favor, because there are tobacco industry documents that were released that clearly say that today's teenager is a future consumer. So let's imagine that kids are not starting smoking. Where will the tobacco industry go? Will they just, they will not have a consumer. So of course they need new smokers. This is the fact. But I can assure you that unfortunately, the regulators do say that some of the delays are because of the new products, that they are not quite sure how to regulate them. And that's, I must say that the excuse that we cannot accept, because we have the evidence that young people are using them. They have to be regulated. That's end of sentence.
Absolutely, absolutely. We are sort of running out of time, but yeah, well said. And just to say, you know, people might look at those stats and say, oh, but 92% of the share is the traditional products. Well, you know, first of all, two things. As all the panelists have stated, there's been no regulation of any new novel products since 2014. Secondly, the data is missing. So just because something hasn't been regulated yet, you know, the data tells you that something else has the biggest market share. There's still a lot of work to be done to unpick what these new devices are doing. So please do keep that in mind. Dr. Jérôme, you want to say something?
Yes, thank you very much, Mariam. Well, I would like just maybe to complete the different answers that we have, and also to answer clearly to Laurent. Definitely, it's very true that if you compare traditional cigarette with e-cigarette, definitely e-cigarette are less harmful because we don't have combustion and we don't have carbon monoxide. That it's a very, very carcinogenic and harmful product. We know that. But when you say that e-cigarette are less harmful than traditional cigarette, it doesn't mean that e-cigarettes are not harmful. For the moment, we have a lack of data. We have some data that they show that maybe we have an impact of cardiovascular disease, notably, as I said, Angela, at the beginning. But to complete that, definitely it's less harmful, but it's not without harm on the health. I would like just to underline this fact.
Perfect, and thanks for pointing that out. I'm going to go to final thoughts, but I will also give Cristiana the floor to give some final thoughts. And I want to actually ask you perhaps to wrap up with this salient point, which is, can we ever have a tobacco-free generation? Over to you, Cristiana.
Thank you very much. And thank you all the panelists for the wonderful discussion. And of course, to all the personnel that are attending the webinar, that the questions were very interesting also. Regarding your question that I appreciate, of course, I think we are on the way to that. And we can't forget that we are now talking about something that is new, but it's also a reinvention. As Lilia was saying, the question is that the industry is always trying to find ways to put people smoking or consuming nicotine. As we understanding that we are talking about new products of tobacco and nicotine, and that's why. But having a new generation without smokers is about denormalize. It's about demystifying the idea that we could be free if we consume nicotine and not tobacco. So we have to understand that either nicotine or tobacco, there are external products. They are not something that we can use for instance, eating or have calories or have energy. That's something that at some point entered our lives that 50 or 60 years ago, without knowing the risks, we allowed to exist in our lives. But now we are in 2024, we know the risks. We know that even without smoke, there is a risk. And so that's why so many countries, so many organizations, so many leagues also, and in fact, all of us together in this room, at least today, are fighting to have this smoke-free generation. And I want really to thank you all for this commitment, because we need this commitment to go forward. Thank you very much.
Thank you so much. And I see in the comments, sorry, audience, we're going to have to start wrapping up now, but Larissa, I see you. She totally agrees with Lilia, says we need to avoid history repeating itself. I think that is really a good point to be made today. It feels exactly like history is repeating itself, and we're slowly, very snail pace, we're sort of understanding that we need to have a bit more regulation of these new products. Okay, so panelists, I will come to you then. Can we have a smoke-free generation? Your thoughts, and I'll start with Angela first, but please be as brief as possible.
Yeah, I think that different countries on different paths on their achieving goal to be the smoke-free generation. There's countries that really have strong regulatory approach, and it's not applied only at tobacco, but also novel products. And other countries are quite far, and they're still dealing with the high prevalence of the tobacco products, currently have more challenges, but the doing nothing is not what we have to do. Government should act and should act now, because if we'll not act now, we'll have much higher prevalence and we'll turn back to the years that we had very high prevalence among the adults. I think that establishing a target, a clear target, and the strong regulation that put in the stepwise approach will move toward this. Later, or maybe some countries slower, but we have to go step by step and to build a coalition to support each other to achieve this goal. And I want to say one comment, because it is different. There was mentioned about less risky and less harmful. The less emissions or the less exposure is not equal with less risk, and we should remember this. Thank you.
Thank you so much, Dr. Jérôme. Jérôme, if you could go next, please, just to wrap up your final thoughts.
Oh, I'm sorry, I didn't hear the end of your sentence. Yeah, definitely, it is a goal for the French National Cancer Institute and also for the government to have a tobacco-free generation by 2032. It's very, very close, and we are maybe to move strongly on this perspective. Maybe different point that the French government have decided to move on to achieve this goal. I said before, ban the path, something very important. Ban the smoking in specific public area. It's something very important. Work on the perspective to denormalize the smoking. It's not cool, it's not fun, and we have to work on this perspective. Definitely consider the plain tobacco packaging on all tobacco products, including the e-cigarette. I know that it's more a nicotine product. And also, we talked about that before with Carlos, increase the price of the cigarette. We know that it works. Definitely it's unfair, because we have also to consider the health inequalities. And maybe the last thing that we have also to consider at the European level, how it's possible to harmonize the price of cigarettes, and indeed to work together to reduce the health inequalities, especially in the field of the tobacco and nicotine. And I would like to thank you for this day.
Thank you so much. And price is definitely a great lever. Eline, what for you then are the levers to get to a smoke-free generation in the future?
Yeah, I think a lot of it has been said, the denormalizing, actually we know what to do. And the tobacco-free generation, it's the direction to go there. And as Angela said, we go day by day, step by step towards, and we see when we get there. At the same time, sometimes I ask myself, why do we need addiction? Why are people attracted to those things? Maybe we should have a broader vision as well. So I'm completely in tobacco, in the nicotine policy, but maybe we also have to support. It was mentioned about COVID, the connection between people, having a warm society, having mental care. I think it could help. It's not specific regulation, but as I said, some people really grow up in very unsafe environments, very unsafe. Yeah, I think so.
Oh, sorry, so sort of unmuted yourself. I'm not quite sure what happened there.
I'm just saying that also other regulations might help in more well-being, that we need, and that we reduce the need for numbing ourselves or unhealthy enjoyment, something like that.
Indeed. Well, I think, addiction is a whole different conversation, and, it goes into, we talk about, what's happening in society. As I brought up earlier, we were talking about, the effects of the pandemic on people's mental health. And definitely one thing we haven't spoken about, but something perhaps that could be consideration for all of you experts, is nicotine replacement therapy, and, finding the tools to help people who want to come out of any sort of perceived addiction that they might have to tobacco products or tobacco-related products. Okay, Carlos, over to you then. Can we achieve these goals of having a smoke-free generation?
I mean, it is clear that we can. We need willingness and we need action, because currently heated tobacco products and electronic cigarettes, they are tricking our decision makers into giving a death sentence to the youth and also the European welfare state. And the time to act is now, also, which we learned from real life cases in which countries that have made a mistake and have admitted, like the United Kingdom. United Kingdom saw that in 2021, cigarette consumption and electronic cigarettes prevalence was equated at 3.1% more or less for each of those products. Now, not only cigarette consumption has increased, but electronic cigarette consumption has doubled. And indeed, now they're acting and they have realized after the mistake. So we in the European Union cannot make the same mistake.
Indeed. Well, listen, I can see that 88 of you are still in the chat, even though we are 10 minutes over. Well, listen, look, I appreciate you for being here. I know that you spent your morning with all of us. I thank you to the panelists. Thanks, of course, to the ECL's Prevention and Early Detection Working Group. Audience, it's been a pleasure to have you part of this conversation. We couldn't obviously talk about every single thing in 1.5 hours, but hopefully we've given you the kind of salient points as to what the conversation should be when it comes to having a tobacco-free society on World No Tobacco Day. You know, can we achieve this goal? Can we get less people using tobacco products or nicotine-related products? Well, let's wait and see. And hopefully one day we will have enough data that can tell us what the effects of these new novel products are. Hopefully there can be more regulation. Now, of course, if you want to catch up or share the debate, the recording is going to be made available on ECL's YouTube channel. It's been my pleasure, as always, to host this debate. I hope you found it interesting. I hope it's given you food for thought. Take care and bye-bye, everyone. Bye-bye.